After the insurgency in northern Uganda, organizations are doing what it takes to defend the rights of children to see them return to school. Together with the project by ADRA, uGANDA is changing lives in northern Uganda, implemented in districts of Agago, Kitgum, Lamol, and Pader. The project is dedicated to improving health-related risks and rights for the most vulnerable. Together with our other partners, they held a mid-term project to review at Fairway Hotel in Kampala, and details are in this report.
Funded by Global Affairs Canada through ADRA Canada, Together project has focused on sexual and reproductive health, prevention of gender-based violence, and nutrition support for children under 5 and their caregivers. Other community practice mid-term evaluation destination workshop, organizations that include Oxfam Care, Right to Play, and others emphasized equipping health workers with skills to deliver inclusive and respectful care.
The uniqueness of the event is that we are learning from one another in terms of how one organization has been able to, let's say, utilize certain methods or techniques in terms of tackling the issues of gender-based violence, the issues of teenage pregnancies, and the issues of sexual reproductive health, to ensure that we can learn from one another and we can be able to also improve what we are doing in our different organizations, but also that this is going to be a continuous process.
They looked at empowering adolescents, especially girls, with knowledge about reproductive health, and also support survivors of gender-based violence with response and safe spaces.
The standard of living remaining high, especially for the adolescents. Much as they're engaged in different economic activities, we are trying to build their capacities and skills, but you find, yes, affordability for some of the services is still a challenge. So they need more hands to be supported, and I think we need also to rethink the approach of how are we skilling them.
So that means that we have more uptake of short acting as opposed to long acting and reversible methods and permanent. So discontinuation is actually inevitable because a young girl is delaying pregnancy if they're in school, or if they're out of school, it is for spacing.
It's very important for us to align with the National Development Plans and Adolescent Health Implementation Plan of 2025.
Together project also strengthens nutrition services, ensuring caregivers and young children receive the guide and support they need to grow healthy. ADRA Uganda, supporting the Together project, looks at more than an initiative that involves dignity, equality, and healthier communities in northern Uganda. Ngabo Emon, reporting for UBS TV.